Hello, I'd like to talk to you today about the calendar year 2014 healthcare benefits that are provided to Johns Hopkins Hospital and health system employees. You'll recall that we started a transition last year to a 90-10 plan. I know there are not many things more personal than our health and that of our families, so let me assure you first, as I did last year, that we will continue to provide 100% coverage available to you if you use Johns Hopkins' own facilities, and will continue to provide 100% coverage for preventive care services. The changes I'm about to talk to you take effect January 1st of 2014. They affect employees of the Johns Hopkins Hospital and Health System, including Bayview, Johns Hopkins Healthcare, Johns Hopkins Community Physicians, and Johns Hopkins International. We need to continue to share the cost of your care. In this case, we're continuing with the 90-10 plan, meaning that for some services, employees will pay 10% of the cost of those services, while your employer, through our health plan provider, EHP, will pay the other 90%. Even though you'll pay 10% of the cost, it is capped at a yearly out-of-pocket maximum of $2,000 per individual and $4,000 for your family. For 2014, this will be for both inpatient and outpatient services within the EHP network. You'll recall that we began the 90-10 plan for inpatient last year and announced that we would be adding outpatient this coming year. Over this past year, since we introduced the plan, we've listened to your concerns and we've watched how employees have responded to the changes. As a result, we've made some changes to our plan. First, some of our copays have been lowered for 2014. Those copays include specialty care and urgent care. One of our biggest changes based on your concerns is the copay structure for primary care office visits. We've decided to make the copay the same whether you see a Johns Hopkins provider or any EHP provider. And so that EHP can better coordinate care, if you provide EHP with the name of your primary care provider, or PCP, that you and your dependents see, that PCP copay will be only $10. If you choose not to provide this information, then the PCP copay will be $20. You also told us that it was difficult to find a Johns Hopkins specialist. So with the help of the Physician Access Services, we'll be providing you with a toll-free member hotline to help members navigate through the Johns Hopkins specialist providers. This service will help you determine the appropriate timeline in which you need care and help you set up an appointment with that provider. When it comes to our healthcare benefits, Johns Hopkins has one of the most generous and sustainable in the marketplace. We will be providing sessions along with your managers within your departments to prepare you for open enrollment, which begins October the 21st. I know you have many questions, particularly regarding the details of the changes I've just told you about. We will be providing information to your managers and written material and informational sessions, so please be on the lookout for those live sessions. You can also find valuable information on the HR intranet site. Thank you.